Today, I'd like us to talk a little bit about suicide. Suicide, by definition, is the act of killing yourself, the act of taking your own life intentionally. And so, suicide is a decision that a person makes and then goes ahead and acts on that decision. So, a person decides they want to end their life and then they have a plan to do it and they go ahead and complete that plan. And we can look at suicide as we can classify suicide into two main categories. Suicide can be impulsive or deliberative. Impulsive meaning it's a person acting on an impulse. So it could be something very stressful that happened to them that they don't know how to handle, they're overwhelmed. And so in the heat of the moment, they decide it's just too much and they want it to stop. And to stop it, for them, they think that ending their life is the most effective way to stop the pain from intensifying or to stop experiencing the suffering that they're going through. And so that's impulsive suicide. Impulsive suicide can be as a result of a mental illness, a diagnosed mental illness, or it could be as a result of just stressful things that happen to us that may not necessarily qualify for a diagnosis of a mental illness. But then suicide can also be deliberative, meaning somebody has taken time to think about it. Somebody has perhaps experienced or struggled with a chronic illness, like let's say cancer, and the pain from the cancer is just too unbearable. And they've tried so many interventions that are available to help manage the pain or to help manage the symptoms that they have. And it's just been a terrible life for them. The quality of the life that they're living is just completely destroyed. And so they've been thinking about ending their life. They've been perhaps even wishing for death. And it's very important typically when you're assessing a person who presents with suicidal thoughts to distinguish between thoughts of death and thoughts of suicide. Thoughts of death, they might just be very wishful that death comes sooner, but they're not going to cause it. They're not going to engage themselves in any acts that would lead to their own death, but they're wishing for it. And you can see thoughts of wishes for death in people who have experienced loss of a loved one, especially if this is death of a loved one, or somebody who's experienced, again, a lot of stress and they just feel like it's too much to bear, or a relationship breakup, or some difficulty in life, some adversity in life. Maybe they've lost their child, and so they might have thoughts of death, but not necessarily suicidal. So they would not do anything to cause their own death. But suicide is the intention, the ideation that they want to cause their own death. They want to be the person who ends their own life. And these are important to distinguish because the interventions differ. If a person has thoughts of death, then you don't need to put them on a suicide watch because they know they haven't had any ideation to kill themselves, they haven't had any intention or any plan in place, they haven't even attempted. And so these can be managed in an outpatient setting. But for patients who present with suicidal intention, so they have the intention, they have the goal to kill themselves, then you want to assess just how serious they are with that goal as well, and if they have a plan in place to achieve that goal, if they've had any attempts before in the past that were unsuccessful. Because one of the biggest risk factors for completed suicide is a person with a past history of suicide attempts that failed, meaning the next attempts might actually be successful and completed, and so they might die by suicide. So you want to prevent that from happening. Now, looking at the recent case of the 19-year-old who died by suicide, allegedly died by suicide, and this is just information I'm getting from social media, I think the way we have conversations about suicide is very important in either promoting the behavior in those who are contemplating it, or discouraging the suicidal behavior in those who are also contemplating it. So the comments that people are typing in, the responses that people are giving, You want to be as intentional as you possibly can, with the knowledge in mind that someone is going to read that comment and that person might be suicidal, and what you're writing could either help this person reduce their suicidal behavior or increase their suicidal behavior. So the way that we have these conversations is very important. I don't have a specific way in which to have the conversations, because the reasons for people completing their suicide are varied and multifactorial. There's no one specific reason that a person dies by suicide or the person decides to act, to commit. I no longer use the term commit, but that's the term that's been used for so long that most people understand it better. Commit suicide. Now we use died by suicide to reduce the stigma attached to the act of suicide. The comments that you put in, the way that we're having these conversations in the public domains where many people have access to what we're saying, it's just important for us to be considerate with what we're saying and intentional to what message we're trying to put across. I've appreciated the comments that I've seen because people are giving their perspectives, people are giving their experiences, people are expressing themselves, and I appreciate that, because the reason why a person ended their life we'll never know for sure, and so all we have is speculation. And perhaps in the conversations that we're having, we might be able to start learning what is sensitive, what is insensitive, how to say certain things, how to communicate. So I think my point for today is that how we talk about suicide is very important in either promoting the behavior of suicide in those who are already contemplating or discouraging the behavior. And so people expressing themselves might give other people permission to express themselves as well. And these people might be people who actually need the opportunity, need the space, need an outlet for which they can express themselves. And like I said, suicide can be impulsive, meaning circumstances just push a person to the edge and a person just jumps over. So jumping over in this case would be the suicide act. Or it could be deliberative. And some countries have started offering assistance for patients with deliberative suicide or deliberative suicidal behavior, either as a result of a mental illness or a medical illness, where a physician might assist the person in completing their suicide in some countries. And so the conversation around suicide is very broad, and the more we open up opportunities for these conversations to happen, I think the better chances we have at learning how to better manage suicide.